Good evening, everyone. I'm David. This is a new type of webinar we are trying to do here, which you have a kind of a student support and a case discussion. Those of you who are not Chinese medicine practitioners or doctors, don't take what is being said here as any medical advice. You do need to see doctors if you have any disabilities or problems. This is mainly a session, a teaching session where other Chinese medicine practitioners can learn from it. So if you have any medical problems, don't take what is said here as medical advice. So we'll begin. So good evening. Like we said, me and Avi, we try to give our support around the globe. Because we're mainly based in Israel, it's easier to do in Israel, and we've been looking for a platform how to do it around the globe. So we came up with this platform where it's kind of still on the runway. We are testing it to see how it goes. And today, instead of, we want to do a case discussion and a kind of less private lesson between a couple of us. I see some of you have been having difficulty coming on board and off board. So we'll start with if any one of the participants. We have Alon, Alon from Israel, Khalil from Egypt, and Pedro from Portugal. If you have any question, and Avi will be joining me, who is my colleague. We can have his experience and his knowledge about this. So, anyone have a case? Pedro?
No, not really, not for this time. I was not aware that we were going to present a case to the participants, but next time, for sure, I'll bring one.
Do you have any maybe questions regarding the technique? And we'll start from there, or I'll just present the case. Hopefully Avi will come on board and can answer a couple of the questions.
If possible, to start with Alan's case, it would be interesting, yes.
Khalil, can you hear us? Okay, Avi, you have a case?
David, can you hear me?
Yes.
Alon is writing you now a case.
Okay.
I just came back.
Okay, a woman aged 83, she's have pain. Alon, can you? The pain is for the last 3 weeks. Where is the pain, Alon?
Shoulder blade.
Shoulder blade. Okay. So, what have on the left side? And what have you seen when you've been treating this patient? Does she have any other pain anywhere else? Along the left arm. Is there any movement problems with the shoulder and the shoulder blade? On the Sanjiao meridian. Okay, so we have pain along the Sanjiao meridian. Elbow pain. Does she have elbow pain? A little. So we have on the lateral epicondyle area, then we have a bit of elbow pain. Middle. Has the patient been in a car accident in the past? And it never. Has it just started to appear? Does she sleep on the shoulder? No. Any neck pain, headaches? Some and pain in the chest area, in the muscular area, the musculoskeletal area. Okay, and what if you could put it on a scale 1 to 10, what is the pain rate? Okay. She checks her heart. She has okay. So what have you? How long have you been treating this patient? Four weeks. Okay. And what have you seen any improvement, or how is the patient reacting to the treatments? Okay. So what we suggest in this type of patient, what you can do is, first of all, you're working according to the diagnostic area. She's having problem that the pain does not subside and disappear completely, I understand. Oh, is the patient taking any medicine? Healthy, just the shoulder pain is bothering her. Okay, so now the patient, you've been using YNSA for the patient? Okay. So we're gonna work. I'll speak a bit about the YNSA, what I suggest to do. First of all, when you have the YNSA, we have a few methods we can go by. We can go by according, especially in shoulder pain. A good tip is to use. Now, if we have pain in the shoulder, I'm gonna just rise up here so we can see. If we have pain in the front area, where basically where the stomach meridian goes, so when you palpate the pericardium neck diagnosis, this area by needling the pericardium point of the epsilon will help for the pain. If the patient is having pain on the shoulder blade, when you needle the heart epsilon point, it'll subside. And if you have in the back area where the small intestine meridian runs, then the liver epsilon point will subside. What I suggest a lot of time in these cases is to palpate these points, the pericardium, the liver point, and heart point, and according to the diagnosis in the neck, needle these points and then go back to see that that has subsided. Sometimes, because if you take it into it could be even an emotional problem in the shoulder. It's got to do with fear. For example, fear. If you think about fear, then the shoulders. People have problems with the heart moving the shoulder because of the heart meridian that's in the area. So sometimes by needling these points, you're helping with the shoulder, and you'll also help the pain subside a lot more and even hold for a longer period of time. A lot of times what me and Avi from our experience do is we go first not use the basic points, or don't use I epsilon. We somatotopy. We go according to the diagnostic areas, according to the neck and the epsilon points, and first we want to treat if there's any emotional disbalance, and also we have a deeper treatment and also coordinating with the meridians. Afterwards, if we see that the pain does not subside or there's still a bit more pain, then we'll go on and add the basic points or the somatotopy I. Does this help you to think in this way, Alon? I see. The questions that Alon brings up, Avi, all of us can see. Okay. Khalil, Avi, do you see any other way you would maybe approach this treatment?
Is it me or Alan?
Just 1 minute. Avi, do you see any other way you would treat this shoulder pain? We lost Avi. So, any other cases? Khalil, you were speaking to me earlier yesterday about a patient you're treating. Would you like to speak about it? Okay, so I see. I wish I had Avi here because Avi has a lot of experience in treating patients with fibromyalgia and using YNSA. I would like him to speak a bit about it. So also, especially in his work, he mainly treats fibromyalgia patients. But as he is offline, so I'll try explain what he does with patients that are suffering from fibromyalgia. A lot of Avi, when he sees patients with the fibromyalgia, he always works according to the epsilon points, which is coordinated with the neck diagnostic or the abdomen. In many of these patients, he always sees certain points that appear. So we have the heart point that is sensitive. We always will see the kidney point, which is sensitive. One of the cerebrum points, and the spleen and stomach points switch between patient to patient. This is what he says. So a lot of times just got to use, heart, pericardium, kidney. And we all know that people with fibromyalgia, what we understand, they also have sometimes the pain that they're suffering from it has some emotional imbalance. But today in researchers, when they diagnosed the patient with fibromyalgia, it was a rheumatic pain and could not be understood. But today what they have started seeing that there are all lesions in the brain, which is causing the pain, the fibromyalgia. And today one of the treatments that we have started seeing, that me and Avi in our practice, mainly Avi in his practice, is a combination between a pressure tank. Avi, what is the treatment called? And YNSA. And you've seen very good results with treating fibromyalgia. Avi?
David?
Yes, I can hear you. Just speak.
Sorry,
Avi.
a lot of problems today for me. Yeah, but I didn't till now.
What I was
What
speaking
are you
about,
talking about?
I was speaking about fibromyalgia, and I would like to hear your experience of fibromyalgia and how you combine it with the pressure tank that you've been working in. Pressure, I don't remember.
The hyperlibridic tank.
Yes.
And an oxygen treatment. The combination, the thing with the oxygen treatment is after the tank, there is 2 hours after the tank, there is a lot of oxygen in the body and a lot of stem cells use pouring to the blood and then helping us to treat better the nerves. So YNSA treatment in the 2-hour window that opens, doing very good result with that. Basically with the fibromyalgia, the treatment in YNSA that works the best is usually just the epsilon point. You're doing just the neck diagnosis, and then the epsilon point is very useful for that, especially for the start. It's for the pain management, but after a long treatment, after 10 treatments, 10 sessions and more, also you can see better results with the fatigue syndrome that comes with that.
You don't see any, you don't need to use the brain points or maybe use the cranial points, maybe it'll be a better effect.
I saw that the brain point it's okay, but the epsilon points work much better and with the result of pain than the cranial. And important thing, it's also to think that it's if there is fatigue from the start or big pains, it's better also to stabilize that with Chinese medicine treatments in the middle. Just to start with Chinese treatment, in the same treatment, then put the YNSA point.
If we take it in general, and your patients that are suffering, let's say, from fatigue in general, let's say chronic fatigue syndrome, you see the same effect that you need to combine before the Chinese medicine and then the YNSA?
Yeah, most of the time I will stabilize that in the same treatment. I will do a lot of Qi or blood stabilization in Chinese medicine, in TCM acupuncture, and then I will use the YNSA, still in the same treatment.
Okay.
A lot of stabilizing the pulse.
So you work according to the pulse diagnosis and TCM or classical Chinese medicine stems and all that, and then you'll combine the YNSA.
Yeah.
And have you seen when you just do the YNSA on its own, the patient feels a lot more tired, or?
It's also tired. Usually it's on the spot. We can see when you do the YNSA that you can feel dizziness. You want to sit more or to lie down or stuff like that. It doesn't feel good in the middle of the treatment, and also if it's getting better after a couple of hours, he has a fall on his symptoms. It's more or more painful or more tired, like after a couple of hours or in the night. The first day is not good with them.
So in general, any patient that is suffering from fatigue, it's you saying that it's better from your experience, you've seen that it's better to combine TCM before your body acupuncture before you apply in YNSA.
Yeah, basically, yeah. I will always be careful with them. Check the pulse also in the middle of the treatment, just to see what happened when the YNSA is starting to work. And we'll send also on the treatment if we need so.
Great, sounds great. Pedro, I see Khalil is. You have any questions, Pedro?
It's just I'm wondering why could this be happening? It just points in the head, they disperse the yang too much. Do you guys have any idea why this happens?
That you stimulate in the yang?
Could it be that the points in the head, they disperse the yang too much, so the fatigue patients, they get a little bit uncomfortable with the YNSA? Do you have any reasons, any possibility of why this happens?
From my experience, I'm estimating that actually we stimulating the yang, and sometimes when the patients, what happens sometimes with patients there's two kinds of fatigue I see. I see when a patient is suffering from, let's say, a severe yin deficiency, which is calling some type of fatigue, and when you apply the YNSA to them, they feel great for a few hours, but after a few hours, they just feel very, very tired, even worse, the condition even worsens. Because basically the petrol, the gasoline for the yang does not exist. because you actually stimulating the young. The young is controlling, but actually you don't have any fluids or any nutrition to stimulate the young. So we have that. So we have the patients that are feeling fatigue afterwards. What I'm seeing in other patients that you have in actually a severe young deficiency, sometimes the body is not possible to hold the young, the stimulation of the young, and then you have these, they feel a lot more fatigue. Straight away, after the first to the second, maybe the first 2 needles, they feel great. And when you apply the 4th needle, they start feeling fatigue. A lot of times we use it when we recognize that after the 4th needle, or we'll stop at 3 needles, or like Avi says, we combine the TCM, and then we combine the YNSA, and then we can add more and more needles according to it. But always you work very delicately with them. I see it a lot in stroke patients that are suffering from fatigue, that do not respond well.
Okay, thanks.
Wait. Does that answer the question? That's what I think is happening. The patient can't respond well to young.
Yes. Yes, I got it. Thank you, David. It seems that Alon has some other question.
Yeah, he asked about a Parkinson patient, age 65, who is suffering from tremor in the hand. So I get to work a lot in the clinic, in the hospital that I work in. We have a Parkinson clinic where we combine in actually kind of multiple treatments. We have Qigong, we have physiotherapy, occupational therapy, all done together, and we add with YNSA. And YNSA, one of the advantages is because the needling is in the scalp, we can work manually with the patient, where the patient can move around freely. So there are very good points. Actually, they don't come from YNSA. One of my students, when I was teaching her YNSA, she came up to me and said, look, I want to show you some points for treating Parkinson, for tremor in the hands. So I'll show you now the points. Let me go back, sorry. I want to share my screen. Just 1 minute. So there are points that are located. If we have the line of GV17, okay, we have all the occipital protuberance, which is located in the back, and we have GV19 above. In the midway between GV19 and GV, for this example, the tip of the occipital protuberance, in the midline on the GV, and then we take about approximately half a centimeter lateral on both sides. There are ditches. Look for sensitivity in these areas, and we needle. I want to show you. I have a way of sharing my screen. Screen share. Okay, so I'm going to show you what I mean. Yes, share. I'll show you the. Sorry, I'll try this again. I want to show you the points where they located. Okay, sure. Now we go back to here. I've opened it, and then you can you see my screen?
Yeah. Not anymore.
Okay. So can you see my screen? I'm going to show you the points that are very, very good to be used on tremor. Okay. These points, my screen open, I'll show you the picture. Okay. You can see my screen. Over here is the occipital protuberance. Can you see it?
No, now we can see you.
can see me and on my screen?
Yeah.
Okay, we'll try this again. Hopefully this will work now. Okay, share. Okay, now it will work. Okay, so can you see my screen?
Yes.
Okay, so we have GV19, which is located here. We have the occipital protuberance, which is located here. So you go, like I said, you look for the midway in between the two. So I'm going to do this so we can see. So I'm looking at the midway here.
But David, we only see the folder. We are not seeing the picture itself.
Okay, so let's skip it because I'm not managing to show you my thing. So just what I'm saying, in between the line between GV19 and the occipital protuberance, approximately half a centimeter lateral to the sagittal line, look for ditches, and these points will be treating tremor in the hands. Now, in Parkinson's disease, it depends what the patient is suffering from. So many times, if he has rigidity, so we're always going to be using the basal ganglion points for treating Parkinson's. A lot of times I use the basal ganglion points also in the yin side and in the yang side. But from our experience, we see when the patient of Parkinson's has tremor, it is better to work on the yang. When patient is not suffering from tremor, just the rigidity, it's better to use the yin, the basal ganglion points. And according to his symptoms, then you use. If his instability, then H point is very, very good for the instability. If we use the tinnitus protocol of YNSA is also very good and very well used also for instability of these Parkinson patients. So, and what you want to do after you've needled them, you want to work with them, tell them to walk, or practice Qigong, or even give them Twina, and etc. Always work manually with them. And we have seen that their symptoms are improving. We're not treating the disease sometimes in YNSA. We're treating, especially in rehabilitation, we are treating more the symptoms that are occurring from the disease. So the disease, they get in the pills, they have neurologists for that. And we are actually just trying to treat the symptoms and prolong the patient's well-being.
And David, about the basal ganglion, you are, if it's a tremor, you always check the elbow, or you use the basal ganglion no matter what?
I will always use the elbow, and what I am seeing when I'm using the elbow, always the basal ganglion area is sensitive. I will always use the elbow, or I'll also use the xiphoid area to see whether there's sensitivity in the basal ganglion area.
So if it's not sensitive, you don't use it at all, even if there's tremor?
No.
Okay.
These points that I tried to explain in the back of the scalp, it's approximately the same height line of about, you go a bit, half a centimeter lateral to GV18, and you look for ditches. These points are a lot better using for tremor.
Okay. Thanks.
Okay. So I guess anyone else, I guess we'll call it a night if there's any other questions. So I hope you enjoyed it, and I hope we'll see you in about next 6 weeks. We'll come up with another webinar. Hopefully more and more participants, and we'll have a larger discussion. So I hope you enjoyed it and learned from it. And like I said, don't see this as any medical advice. Have a good evening to all of you, or good morning, or good day, wherever you are located in the world. Thank you, Pedro. Thank you, Alon, Avi, and Khalil. See you guys. Good night.